Hospital discharge personal health budgets can be swiftly organised when patients have become medically fit to go home. They enable choice and flexibility for the individual and reduce dependency on traditional services. They can be used across all discharge pathways, but it is envisaged that they will mainly be utilised for individuals being discharged on Pathway 0 or for low-level Pathway 1, which could remove the need for a commissioned service, which we know are in great demand. They can also be used for people returning home from a care home bed, provided through a Pathway 2 placement. Through the hospital discharge personal health budget process, payments can be made to reimburse approved expenses. A one-off personal health budget for up to 4 weeks, which will be determined at the time of planning. The maximum available for each budget in Devon is £1,200. Once the individual is medically fit, the usual discharge planning commences with a person-centred conversation between a patient and a discharge coordinator or therapist. If this conversation establishes that there are short-term reasons why their discharge cannot happen without some further support, the What Matters to You conversation needs to continue with information about the possibility of a hospital discharge personal health budget to cover their short-term need. When solutions are identified to overcome obstacles preventing an individual's discharge, opportunity can be given to support and co-create innovative choices together with the person. These should enable individuals to return safely to their home or former place of residence. The person might want to involve their family or carer in generating ideas to meet their short-term needs. Creative thinking can present innovative solutions. An example of using a hospital discharge personal health budget for the use of bus or taxi fares, which enable family members to visit the individual if otherwise difficult. Although family cannot be paid directly for delivering personal care, a payment to temporarily relieve the family member of other tasks or duties may be appropriate. There's opportunity to think imaginatively. The budget could include childcare or dog walking, for example. All suggestions that offer timely and safe solutions will be given consideration. Exceptionally, payment towards loss of earnings for someone taking unpaid leave to provide short-term support to enable discharge may be a possibility. Once the user agreement for the budget has been signed, clinical sign-off should be completed in the normal way. The Integrated Care System, formerly CCG, is willing to consider any alternative way of enabling an appropriate, timely and safe discharge. By using this short process, you could change someone's quality of life, enabling them to receive what matters to them on and after discharge. Devon Integrated Care System, formerly the CCG, are willing to consider alternative ways of enabling an appropriate, timely and safe discharge, rather than waiting for traditional services, thereby facilitating patient flow. Don't delay if the quote is not yet available. Send the email to sound out the suggestion with the team.